anyone who will join us. We pray that you minister unto us your mind. May we carry out what you want us to take out of this meeting. Reign in this meeting and have your way. In the name of Jesus, we pray with thanksgiving. Amen. Great. So today we have a friend of ours and my personal friend who is going to help us through our topic for discussion today, and the topic is common cancers. So without much ado, let's welcome Dr. Teresa Lotodo to give us the talk. Doc, you're invited.
Thank you, Reverend. And I just want to appreciate the CGC church leadership. I want to appreciate the youth department for giving me this opportunity to share about the cancer burden and control in Kenya. So I believe I will not speak as if I'm talking to people in the medical school. I'll try to simplify. But you have the opportunity to jot down your questions, and then maybe we could try and answer them after the talk. So it's in full screen. You can see it clearly. Can you, Reverend?
Yes, please. We can see.
Okay.
Yes.
Okay. So thank you for everyone who has joined in, the youth and other people who are joining in. I think it is important to demystify about cancer and just learn some few things about it, because it is one of the focus of the government currently. It falls under what's called the chronic diseases or non-communicable diseases. Before, the government used to put a lot of resources on what we call the infectious diseases, that is HIV and malaria and TB. But now the focus has shifted on chronic diseases like diabetes, blood pressure. So I'll just start by giving us what's the definition of cancer, and then I'll go on to explain how the common cancers that we have that affect us present. How do we know that these cancers, somebody could be having signs of these cancers, and then what do you do about it, and also what the government has done about it. So I'll start by saying that cancer is growth of a group of cells. So we know that a human being is made up of millions and millions of cells that form the organs in the body, forms the eyes, the hands, the liver, the kidney, all those organs that are formed by single cells. So what happens in cancer is that some of the cells in the body starts growing. Okay. And this cancer affects any part of the body except the teeth, the nails, and the hair. Those are only the three parts of the body that are not affected by cancer, but the rest can be affected by cancer. So normally cells multiply and die in an orderly way so that each new cell replaces the one lost. Each cell has what's called a lifespan. After it has served its lifespan, it dies. And that's why somebody is able to grow from a newborn to an adult. But sometimes these cells become abnormal and start growing abnormally. So they increased in a very fast rate until they form what is called a tumor or a mass or a swelling in the body. And that's when people start saying you could be having maybe cancer. And some of these growths are usually cured, but some grow until they're able to, they go to different parts of the body. And that's what now we call cancer. So in some cancers, such as leukemia, the abnormal cells build up in the bone marrow and the blood, okay? So this cancer could affect a specific part of the body, a local swelling, which can later go to other parts of the body, or it can affect the bone marrow, and that's what's called cancer of blood or leukemia. Like maybe on a skin or a surface of your body, this is how cells divide. From the first circle, we see at the lower side, we see what's called the basement membrane, and that's where the new cells start growing, and then they form the first layer, and then those ones grow into the second layer as new ones are being formed, and then they grow into the third layer until they die off and shed off. Okay, like even in the skin, when you wash, you sometimes see some dirt coming out. Part of it is the dead cells from the skin. So what happens is that sometimes inside this cell, this is a cell, which is what we can see, the white with a small dot inside. So that's the cell. And inside the cell, we have what's called a DNA. So sometimes because of some things you have, some bad genes you have inherited from your parents, exposure to some things in the environment, which I'll talk about, or maybe even some food which you eat, then this center of the cell called the DNA gets damaged. And that's when it starts making abnormal cells. And then these abnormal cells now start dividing abnormally. You can see on the third line, the third circle, they start dividing abnormally until even they breach the skin. Now they become a swelling. And then now it reaches a point, now all the cells there are abnormal. They have grown in size, and you have even some forming blood vessels, and then these cancer cells can enter the blood vessels and go into the surrounding tissues or even in other distant organs. And that's why you hear of stage 4 disease. Stage 4 disease is that the cancer has left its original site and has gone to other distant organs. That's now what's called stage 4 disease. So this is just data from what's called global burden of disease, and it just tells us what is the leading causes of death in the world. This is data from 2016. And you can see that cardiovascular diseases or diseases of the heart are the leading causes of death in the world. That is causing about 32% of the death. And then you can see cancer comes number 2. So 16% of deaths in the whole world is caused by cancer. Chart. And then when you also look at age, that's why we say it's important to talk about cancer. It doesn't matter what age. It's not just a disease of the old, okay? You can see that worldwide, this first graph on the left, you can see that in people who are less than 20 years old, you can see that 1% of cancers occur in that age group. In 20 to 34-year-olds, whereby maybe most of our youth will fall that age group. And you can see that it is increased like that. By the age 55 to 74, that is where most of our cancers come from. And these are cancers of different parts of the body. And then as one ages further, more than 84 years old, they start reducing. And on the right, we have data also from our cancer registry in MTRH year of 2017. You can again see 0 to 4 years, we have a number of cancers there. Up to the age 30, 34, you can see it's increasing. From 35, it starts going up. 40, it's going up. 55 to 59, it's going up. But when you look at the cancer in our setup, like in Kenya, the age group is lower. We actually see our cancers in younger people than in the West. You can see here it is between 55. But in African setting like ours, we see even 59 being like now there where we get the peak. So you can see the age is, we see our cancers earlier than the rest of the world. So what are the leading causes of cancer? What you can say is that cancer, we are not able to explain what causes cancer entirely. But studies have been done which just give some pointers to some of the factors that could contribute to cancer. But cancer is usually, it is like there are many players in the field that causes cancer to occur in a human being. One of them could be genetic. You can see family history, genetic here, about 5% of cancers could be because of some of the bad genes you. That's why sometimes when you come with cancer to the hospital, they'll ask you, is there somebody in your family who has died of cancer or who has cancer? Because some of these cancers are seen in the family lineage, okay? Occupation, what you do, sometimes can expose you to cancer because of the environment, okay? Some of the things that we do exposes us to chemicals, like if you work in a to being predisposed to cancer. Sedentary lifestyle, that means you are not doing any exercises, you're not, you're leading a sedentary lifestyle. It is a predisposing factor to cancer. Alcohol use, it predisposes people to cancer, especially cancer of the liver. And then, of course, you have environmental pollution, tobacco, cigarette smoking. They also say even secondary smoking, like somebody smokes in the house and you don't smoke, but you inhale that smoke. It predisposes you to cancer. And you can see that 32% of the cancers are associated with smoking and tobacco use. And then diet. A lot of diet, what we eat, will predispose people to some of the cancers, especially in the passes right from the mouth all the way up to where the what's called the anus. So along that track, most of the cancers that come about from there is because of what we eat, and we'll see some of the diets that predispose people to get cancer. So when you look at Kenya, we see that again, when you look at the three most disease and death, the first one is heart diseases, or what's called cardiovascular diseases. The second is infectious diseases like HIV, TB, malaria. And then number 3 is cancer. And cancer causes 77% of deaths per year in Kenya. And there are 39,000 new cases detected every year. In all our facilities, especially where cancer treatment is happening, they are able to record 39,000 new 7,000 deaths. So you can see even a third of those patients who are diagnosed each year, a third of the, three quarters of them actually die of the cancer. And those who are affected are less than 70 years. About 60% of the cancers are in people who are less than 70 years. So which are the leading cancers in Kenya? So in women or females, the affects 34 people per 100,000, then cancer of the cervix, and we'll explain where these cancers occur. In men, the leading cause of cancer is prostate cancer. The leading cancer in men is prostate cancer, and then followed by esophageal cancer, or cancer in the what's called the food pipe. When you swallow food, where the food passes until it reaches the stomach, that's what that's the second commonest cancer in men. And we see that our patients come to the hospital very late. 70 to 80 of the 80% will come very late in stage 3 and stage 4 because of, one, lack of awareness. People don't know that they are suffering from cancer. They are going to hospitals. They are being treated for malaria and other things, and yet they are having cancer. Inadequate diagnostic facilities, especially in our lower level hospitals, lack of treatment facilities, high cost of treatment. Yeah, cancer treatment is very expensive. And sometimes if you don't have like what's called NHIF card, sometimes you are not able to cater for that, for the treatment of cancer. It's very expensive. Some people have had to sell their land to be able to treat, and yet at the end of the day, again, the patient came in very late and we lose the patient. And then high poverty index, of course, it comes with the cost of treatment. Contribute to our late diagnosis of cancer, and which leads to the high death rate. So starting with the breast cancer is the highest in our setup. Actually, it's more high in the Western countries. In the whites, they have a higher rate of breast cancer. In our setup, again, breast cancer is. So there are some risk factors that are associated with breast cancer. So we have what's called non-modifiable risk. That means those are things which are beyond your control. So gender and age, of course, being female predisposes you more to getting cancer, breast cancer, but also breast cancer occurs in men. Okay, a very small percentage of breast cancer occurs in men, but the highest number is in females. And of course, as you grow older, again, there is a higher chance of history, like you have, maybe you suffered from another cancer, there's a high risk of developing breast cancer. Family history, you'll be asked maybe in your paternal or maternal side, especially paternal side, if there's somebody who had breast cancer. Usually they have some genes, which if you inherited from them, then you are more predisposed. But doesn't mean that if you are relative had a breast cancer that you'll also get, but you are predisposed to getting cancer, especially if you inherited that specific gene, which can be tested for. And then having early menstruation and late menopause. Let's say for girls who start their menstruation as early as 12 years, and then maybe the menopause goes to maybe after 50 or 55 years, they have a longer period of being exposed to hormones, the female hormone, the hormones in the women, and so they are more predisposed to get. When somebody has larger breasts, there's higher predisposition to getting breast cancer than one who was smaller. And then, of course, any other conditions in the breast, infections and everything. The modifiable risk factors, which we have control over, is body weight. That means if you're obese, you're more predisposed. If you have less physical activity, if you have leading sedentary lifestyle, like we've talked about, alcohol use, smoking, exposure to hormones, again, like in the what we use for contraceptives, like the pill, you're being exposed to those hormones. Again, you are more predisposed to getting breast cancer. And then pregnancy and breastfeeding. So for people who have no children, they are more predisposed to getting breast cancer. So we see a lot of breast cancer even in nuns. Okay. Breastfeeding, those who have given birth and have not breastfed, they are more predisposed to getting cancer than those who breastfeed. And then, of course, exposure to X-rays and this other form of radiation. So what are the signs and symptoms of breast cancer? So if there's pain in the nipple or in the hole or any of the on any side of the breast, if there's any pain, you need to be seen. If the nipple is inverted, instead of coming out, it is turning inwards, that is a sign. It may not be, but it's a sign which you need to be seen. If there's some rash or change of color on the skin or around the nipple, if there's change in the size or the shape, let's say you look at the mirror and you find that one breast is maybe heavier looking, that breast is having a problem, needs to be checked. If there's dimpling of the skin of the breast, if there's a lump, you can feel a lump, and we'll show you how one assesses for any swelling in the breast. Then that is a sign. It could be cancer or not cancer, but needs to be seen, needs to be looked at by a doctor. And then if there's any swelling, and if there's unusual discharge from the nipple, let's say you press the nipple and some either bloody or it needs to be looked at. So those are some of the signs that may suggest that you could be having breast cancer. So it needs to be looked at because it may be or it may not be. So what is the government recommendations for breast cancer screening? Because in most of our facilities, like here in MTRH, we have this Chandaria Cancer Center where they offer free breast cancer screening. You can examine to check if there's any lump or any abnormal swelling in your breast. So for people for 25 to 34-year-old, you are recommended to go for maybe a breast exam in a center with cancer screening every 3 years. At least if they check and there's nothing, you can go there between 1 to 3 years and be checked again. For those aged 35 to 39 years, again, you can again repeat the same after 1 to 3 years, and they can also do an ultrasound if they feel like there's maybe a swelling there. For those who are 40 years to 55 years, they'll do the breast exam and what's called mammography. Mammography is some form of X-ray, which will be able to pick even tiny swellings or tiny growths inside the breast. This should be done annually, every year. Once a year, you go for that exam. And then as you grow older, again, the same is recommended. They don't recommend that you come in as much as possible because now you are like beyond the age which is more predisposed. So breast exam is not usually, self-breast exam is something that one can do in their own comfort or in their own houses. This is recommended for girls and for any woman. Cycle, because usually during the menstruation, there could be some lumps you feel in the breast and they are painful, which is because of the hormones that that are going on, the hormonal change in your body. But after a menstrual cycle, then you can be able to do this breast exam. So I'll just take you through what happens is that, so first of all, the first step is you're told with your arms relaxed by your side, look for changes in the shape and the color or on the breast or on the nipple. That's on either side. And then number 2, place your hands on your hips and press firmly, bend forwards and backwards, looking for any changes. Number 3, standing with the one hand behind your head, explore your entire breast, starting with the armpit and finishing with the nipple. So you go around from outside towards the inner, towards the nipple. And then you do also on the other side. So you move up and down and then in circular motion. And then again, you can lie down on the cushion and then you repeat the same movements. So just check if there's any abnormal swelling you can feel on your breast. And again, at the end of the step 6 is you just press the nipple and see if there's any nipple discharge. And the importance of this is that this is something you can do in your own room, and it helps you just to pick if there's anything abnormal early. because we have said the issue which is causing more deaths is that we are picking these things late. But if it's picked early, in first and second stages, then it can be managed and you can get a complete cure. And then we have the cervical cancer. Here we'll go back to anatomy. This is the reproductive organ of the female. So we have of the baby. This is where a baby sits. And then we have the fallopian tubes, these ones which look like hands. And then we have the ovaries or the eggs. So the egg is usually released from here, goes through the fallopian tubes and comes here. And then if there is a fertilization, or if somebody is married and there's fertilization, then the egg will be implanted in this part, what's called the endometrium. This uterus is what's called the cervix. And that's where the cervical cancer affects. Okay, so we have the cervix here, we have the vagina, and then the vulva outside. So on the right side, you can see that this is cancer. This is how cancer looks like, which affects the cervix. It affects that part of the female reproductive system. Okay, at the opening of the uterus, where usually is where the baby grows from. So what are the risk factors for cervical cancer? There is a virus known as human papilloma virus. It's usually a sexually transmitted virus, and there are usually so many different types of HPV, but about 18 of them are the ones which can cause cervical cancer, okay? And from these 18, there are 2 specific ones which are the ones which are detected in patients who have cervical cancer. If one is involved in sexual intercourse, there is a risk of contracting this human papilloma virus. But the thing about cervical cancer is, even if you've contracted the papilloma virus, some of them will resolve on their own. But some of them, after 10 or 20 years, some of these viruses are going to cause the cervical cancer. So it usually it takes long before, from the first exposure to when you develop cancer of the cervix from this infection. And then the other predisposing factor is having many sexual partners or becoming sexually active at an early stage. From research, this has been shown to be one of the causes of cervical cancer. So cervical cancer causing HPV types are nearly always transmitted as a result of sexual contact with an infected individual. Okay, so women who with HPV, which raises their developing cervical cancer. So you've seen active at an early age and having many sexual partners. So what are the modifiable risks? So having sexual intercourse at early stage, okay, or early marriage, early childbirth, having too many children is predisposing factor to cervical cancer, multiple sexual partners, having unprotected pill use, stress, and other conditions which reduces your immunity, like HIV/AIDS. So those are the modifiable risks that can predispose one to getting cervical cancer. The non-modifiable risks are like the ones we saw in breast cancer, family history, low socioeconomic status, and if you are born with some decreased immunity, which you could have acquired as you are born with it, so you have no control over. When there's abnormal vaginal bleeding, that means one is having some spotting. You can see some spotting, and yet it's not time for menstrual period. That is a sign of cancer of the cervix. Bleeding in between periods. So you know that your periods are coming at this time of the month, but now in between you're having this spotting. Then it's a condition. It's something suspicious, or excessive foul smelling, blood mixed discharge, again, could be a symptom of early cervical cancer. Bleeding, post-intercourse, and then sometimes you could have pain in passing urine, stool. That means maybe the cancer has even now gone. It has affected other organs like the bladder and even the rectum, where then you could be having problems in those systems. Okay. So what happens for these patients is that again, there are cancer screening centers for cervical cancer. So for breast cancer and cervical cancer, the government has put in measures to ensure that people can go for early cancer screening for breast and cervical. 30 years of age, you can go for cancer screening. So what they'll do is they'll take some smear from the cervix, and then we look at it under the microscope and see if there are any abnormal changes, which will mean that they can be picked early and managed early. Sometimes they do the tests, they can do using other sophisticated tests, okay, to look for that virus. Okay. This is a cancer which occurs in men above 50 years. And just to show where the prostate is, so this is a picture which shows this is a bladder. This what looks like a balloon is a bladder, and you can see urine inside. So usually after taking a lot of water and fluids, you'll feel that your bladder is full. Okay, this is where the urine is in the bladder, and then you go and out. So around this urethra is where we have the prostate gland. Okay. So when a prostate gland starts enlarging because of cancer or just maybe benign conditions, it starts compressing on this urethra. Okay. And so you find that an elderly man starts complaining, they start going for frequent urination. You know, they go to the wash at night, they can wake up even like 5. That you're having an enlarged prostate which is compressing the urethra. You have what's called urination hesitancy, as in you want to, when you want to pee, it's like it's not coming out. Okay. And sometimes it's not giving you time to actually reach the washroom. It wants to come out immediately. So again, that could be a sign of enlarged prostate. Nocturia means you go to the washroom several times in the night, and then there's decreased force of urination. It's not, that trajectory is not there. It's not coming out with that force. So if an old man starts complaining of these symptoms, and not only old men, because 50-year-old are not old people, then there could be suggestion that there's an enlarged prostate. And that enlarged prostate could be something which is benign, which can be removed, then you're okay, or it could be cancer. Okay, so it has to be a small part of that a benign thing, or it has turned out to be cancer. And for prostate cancer, we don't have a screening program in the government for that, because usually they look at many things before they put up a cancer screening for a specific cancer. So in Kenya, what we do is just the screening cancer, the cancer which are being screened for is breast and the cervix. But for anybody, usually we are just recommending that you go for a checkup at least once a year, and the doctor will look at all these things which could be suggesting any cancer developing. Okay, so if you go for a medical checkup once a year, it's good enough to be able to pick these cancers early. So, and then we have esophageal cancer. We said cancer of the food pipe. Okay, so cancer could occur in any area near. It means now there's a growth inside which is compressing food. Okay, So this patient could present, we could have complaint of pressure on the chest. They feel like this pressure at the chest. They could have difficulty in swallowing. And this is whereby somebody used to eat ugali. Now they feel like they cannot eat ugali. They want food which is more soft. And when it grows even to a place where now it wants to completely and so you find these people coming very malnourished because maybe even they're able to just take in water. They're not even able to take in even rice or even soup. So it's progressive until the person is not able to swallow anything. And then the other complaints they have is indigestion and heartburn. And then weight loss. Weight loss is a complaint in all the people with cancer. When you used to wear your clothes and you are eating well, but you start seeing that you're losing weight. In all the cancers, weight loss is one of the complaints, okay? So it's something that can tell you that if you see somebody's losing weight, it's something to start thinking about if it could be cancer. And then in the stomach, cancer of the stomach, okay? How does one, or what are the signs of cancer in the stomach? Usually a patient feeling being full. They have difficulties in swallowing, especially now if it's near the esophagus, feeling bloated after meals, heartburn, okay, stomach ache, vomiting, sometimes which may contain blood. Those could be signs of stomach cancer. And what I want to point out here is that heartburn. You know, we have these heartburns and indigestion, and we go and we are being treated for peptic ulcer disease. You're told you're having ulcer, you're having ulcer. And some of these patients who have been treated for ulcer so many times have turned out to be having cancer of the stomach, okay? So insist that you get what's called endoscopy. Endoscopy is where they'll put a pipe into your stomach. The doctor will look at it and see if there's any growth. They'll take a piece of it and it's taken to the laboratory and check if you're developing cancer. Okay, so this treatment for heartburn and ulcers of stomach cancer. Okay, colon is the other cancer which we have. Colon is the large intestine. Okay, so after food has come into the stomach, it goes through the small intestine and then comes into the large intestine and then out. Okay, what are the signs of colon cancer? Abdominal pain. You're having pain in the lower part of the abdomen. When you go to the washroom, your blood maybe contains stool, the stool. You're losing blood through the, as you're going to the washroom, to pass stool, you're losing blood, okay? So some of the patients who come with blood loss or anemia in adulthood, one of the things that we think about is they could be having cancer of the colon because they are losing blood. And then changes in bowel pattern. Sometimes you're having constipation, sometimes you're having diarrhea, you know, alternating like that. That could be a sign of colon cancer. And then lastly, we have the leukemia. In the bone marrow become abnormal, and then you get cancer in the blood. Okay, so this is usually my area where I look at people who have cancers in the blood. Okay, so patients will come with fatigue. You used to walk up a hill. After some time, you feel tired. The activities you used to do every day, you are no longer doing them. You feel tired. One of the presentations of cancers of blood is anemia. You are losing blood. Okay, there could be any swelling, maybe getting infections every time. Headaches also is a sign of maybe anemia because of cancer of the blood. So those are some of the common cancers that we see in the hospital. And the issue is sometimes we go to our facilities, our health centers, our our peripheral health facilities, and you are being treated there. You go the next week, you are being given some drugs, you don't see any changes. It's usually good to move to the next stage, because we've seen patients who have been treated for several months. By the time the diagnosis is being made, it is late. It's already stage 3 or 4, and yet it could have been picked several months before. Okay, so if you're not getting any relief when you go to your facility, a larger facility with more specialists. Okay, so how do we treat cancer? So first of all, we have said that there are about 39 or even 47,000 new cases of cancer every year with 33,000 deaths. The number of specialists in Kenya who deal with these cancers are 35. The oncologists, they are only 35 in the whole country, and there are only 12 treatment centers, okay? And the largest being Kenyatta. We have the other private facilities, and many counties now are putting up cancer centers, okay? So usually when a diagnosis of cancer has been made by a small part of that growth being taken to the laboratory, and they tell you what type of cancer it is, so there are different options. So the doctor could decide that we remove it. So they'll do surgery to remove that cancer, or they could say you go for radiation, whereby you'll go under a machine to kill those cells. And then the other option is called chemotherapy, where they'll give you some drugs through your veins. And usually it can take several months or even years, okay? And sometimes they combine 2 or 3 of these modalities of treatment. So it's the cancer specialist will decide, depending on the protocols, how to manage you. Of course, there are others which are being researched on, which these 3 are the main ways of treating cancer. So how do we prevent cancer? We have said that some of the things are beyond us. We may not have much control over what genes we have in the body. We may not have much control over some conditions that we are born with. Being what gender, that one is beyond you. But there are some things that we can do prevent or cancer, okay? So one is like lifestyle choices. We have said alcohol, tobacco, issues of physical activity, avoiding obesity. Those are things that are within our control, which you can be able to do, okay? So we choose to live a healthy life, eat healthy, eat balanced diet, and be involved in like hepatitis, if one contracts hepatitis B, C, HIV, H. pylori. H. pylori again is the one which causes a lot of ulcers, and again it can lead to stomach cancer of the stomach. Okay, so if they are treated early, then the body is not exposed to developing cancer later on. Screening tests, we have been told, screening for breast and the cervical cancer is available. So we should take up that medical checkups, okay? And then some of the cancers that we are predisposed to, especially the ones for the colon, are associated a lot with food, okay? So we are advised to eat diet rich in whole grains, vegetables and non-vegetables, and fruits and legumes. Those are very healthy foods that we should eat, because when you eat a lot of roughage, it stool staying in the colon for a long time, and so it doesn't cause that inflammation which could predispose one to getting cancer. So a lot of roughage is advised. Limit consumption of fast foods, highly processed foods, a lot of sugars, a lot of starches, avoid them. A lot of red meats, avoid a lot of red meats, a lot of sweetened drinks, alcohol, of course. Okay. And the other things we talked about, breastfeeding and all that. So, and all this, when you take this into to be part of your life, you are you are not only preventing development of cancer, but also you know, any other disease, you know, the diabetes, the hypertension, you are just leading a healthy life. You have only one body to take care of your body. So these are my references. I want to say thank you for giving me this opportunity. There's a lot to learn about cancer. This is just an introduction. And so if there are questions and everything, then you could bring them up. Thank you, Reverend. Please.
Thank you so much, Doc. We are grateful. It's been the floor for questions. So please, if you have any questions, you may lift your hand so we can call you. I hope you know how to navigate question, please. You may show it by lifting your hands, and we'll ask you to unmute yourself and then ask. Any questions on cervical prostate cancer and all the one affecting the esophagus and all that? Any questions? You may be asking for the purpose of maybe somebody you know might be suffering from them or anything. Any questions, please? Any questions? All right. I see Juma Don. Please unmute yourself and ask your question.
Okay, thank you. My name is Donald, and there is this things we have been hearing. Okay, I read somewhere that masturbation leads to can be a cause to the prostate cancer. I don't know if it's true. Doctor can tell us, or maybe it's just a myth.
Okay.
Yeah, Doc, I don't know whether you got the question.
Yeah, I got the question. If masturbation predisposes one to get prostate cancer?
Okay.
You want me to answer that or wait for
No,
more
no,
questions?
please go ahead. Please go
Okay,
ahead.
so at least from my reading, the research of one of the predisposing factors to cancer of the prostate. But I realize when we talk about cancer, people have different views and beliefs, and one would propagate what they believe in about the information that has been put out there in public. So even some will tell you if you take of activity, then you are predisposed to getting this type of cancer. But from the research I've done, I've not come across that as at least as a documented cause of prostate cancer. Thank you.
Great. It's important for us to know that so much is not known about the causes per se, but it's about the risk by things we engage in that would increase our risk factors. That predisposes us to the disease. We really appreciate that, Doc. Any other question? Or if there is a contribution to, it's also welcome.
Yeah, I see my colleagues here who we work with there. Evans is here. Anne from Cancer Registry is here. Is anybody, if there's something you want to add, a comment, it doesn't have to be a question.
Yeah.
Yeah, welcome.
Great. Any contribution, any question? Let's please take advantage of the platform, because so we have the opportunity to ask. So let's take advantage. Any questions, contributions? Wow.
Esther, you are trying to be a doctor. Say something. Yes.
I think
I've ambushed you. I've ambushed you.
yes. Yes. I think what I've realized is that so long as like a cancer is diagnosed early, it's easier for it to be managed late. So it is wise to like go for screening for the lady. You should do breast cancer screening or even cervical screening, so that now you can know early and such things can be managed earlier, and you'll have a better life if it is discovered early and it's managed earlier. And also I think it's also a good opportunity that today people have learned more about cancer, so it will be good you also educate other people in the community. You tell them what you've learned, and I know you've realized some things that you had before that you now realize are myths. Know that they are myths, so that they can know you can actually get treatment for these cancers. Yes.
Great.
Thank you.
Yeah, we are grateful, Esther, for your contributions. Any other contribution, question?
Welcome.
Ojuak is here. We have we didn't used to have the radiotherapy machine at MTRH. The only radiotherapy machine we used to have is the one in Eldoret Hospital. But now MTRH is bring its equipments, and soon they'll be starting to give radiotherapy here, because patients used to be sent to Kenya. Some are sent to Aga Khan, and it used to take long before treatment. So Ojuak will be working in that field. He will be working in the radiotherapy unit. Ojuak, anything you want to add?
That was a very, I've enjoyed it personally, and I've also learned a lot. Just to verify what you've just said is that on Friday, on Saturday, we received a radiotherapy machine. It's going to be a variant machine. It's just slightly small, lower than a true beam. It's a vital beam. There is being, and also treatment for electron for skin cancer, like the electron energies. So I think we are in for a good time actually in Kenya, and we welcome you to come for screening, and we also welcome you to refer patients to MTRH for radiotherapy. I think that's the only thing I have to add. There's a specific question on radiotherapy. Hello.
Thank you, Evans.
All right.
Thank you. Much appreciated.
Yes. We are grateful. Any other question, contribution? I know Doc is trying to ambush people. So
Yeah, they have to say something, but I'll not ambush anybody anymore.
raising of hands. Nothing bothers anybody. We are all very okay. Okay, please, Deacon, go ahead.
Thank you so much. If I'm clear.
Our voice is breaking, but I hope Doc hears you.
Yeah, just go ahead.
Are you able to hear me? I'm moving in my house. So Dr. Thank you so much. I've just learned that the things we take for granted, things we see they're not serious. Issues like being keen with the issue in the size of the breast. Sometimes we assume it's it's the normal things, but I've realized that we need to learn to being regular checkup. Thank you so much. We are grateful, Daktari. You've taught us well. When you look at the charts, we have a chat from Evans Ojwak saying, thank you, Terry. Mary Tongola says, this is enlightening. Thanks, Daktari. Anne Koskei says, very informative. Thank you, Daktari. Priscilla Milimo says, so informative. I have learned a lot. And Juma says, great from the guy at the machine. So, Daktari, we are grateful. We've learned and we will continue to learn. The Lord bless you so much.
Thank you very much.
Great. Yeah. All right. So we'll just move on. Please, Doc, give us your closing remarks.
Yeah. So thank you all for listening. I don't take it for granted that you have used your bundles and put in this hour to listen to this. What I can say is that let's take care of our health. Be aware of what you eat. Be aware of what you eat because it has long-term repercussions. You may not see it now, but 10 years, 20 years down the line, you may find that it's affecting you in one way or another. So let's be keen about what we eat. Let's do our exercises. Let's go for checkup. And let's just say also, even the doctors and the clinical officers and the nurses at the peripheral facilities, we usually go out again and refresh that knowledge because nobody has monopoly of knowledge. We are all learning. Even me, I'm learning. For me to prepare this talk, I had to sit down the whole of yesterday. So we are all learning. we are learning new things every day, and knowledge is power. Let's get informed, and let's take action about our health. Let my mom say.
Hello, Mom.
I'm Doctor's mother.
Great.
I came today to see her, and then I was also ambushed. when I heard about cancer, I just came here to her, and then I was staring at the screen. I was also impressed, and I've learned a lot. Thank you for preparing this speech, and I'm.
Thank you.
So just to challenge the youth in the forum, my mom is doing her PhD in counseling at Catholic University. And so learning does not stop. We continue learning. she'll be going to class on Tuesday to do her third semester, to do her third semester for this year. So
Okay.
yes, so that's just a challenge that we are not too old. Thank you.
Wow. Great. Great. So
A good challenge. I think we are all going back to school now.
Yes.
That's a good challenge.
Okay, thank you.
great. So I'm seeing requests for the recording and stuff. Please, if you want to get the recorded talk, kindly post and Demaris who will sort that out. So you just post your email in the chat, and then it will be sorted out. Right. So, Doc, we want to say a big thank you, a big thank you, and thanks for letting us enjoy your mom today also.
Yes.
Yes. Yes.
And you're free to ask for.
Yes, we are actually the fact that we have cardiovascular diseases and HIV and AIDS.
Yes.
The number one and number two, it will be interesting to have talks on these two.
Okay.
Yeah, but we will talk on the other side.
Okay.
Yes. So thank you so much. Thank you all for coming. I can see our elder fellowship around. Please say hi.
Thank you for the good work. The Lord bless us so much. Thank you. Asante sana daktari. Thank you, Reverend John. Thank you, Caro. The Lord bless you. Thanks.
Asante.
Thank you so much. And if there's any other person in the leadership I am not seeing, please forgive me. But I will appreciate that you say hi to the. Besides that, to the deacon to take over now. Thank you.
Thank you. I believe we are all set. I would like to thank our sister Damaris, who makes sure that we've had our meetings, who works on the links, who worked on the poster. And I would like to thank our pastor for your availability, for your support. I would also like to thank Daktari for your time, and also thank everyone who has made sure has joined us this evening. We don't take any one of you for granted. It's always an honor to see you. Our visitors on board, we are glad, we are very grateful that you are able to join us this evening. Otherwise, the Lord bless us so much. Our next meeting takes place on 11th of October, unless otherwise, but our next meeting is on 11th of October, same time, same venue, same place. The Lord bless us. We are free to leave unless somebody has something else. We are free to leave. Do have a blessed week. Bwana wabariki sana.